so often we go for the pap smear shortly. But if you detect abnormal cells, you need to follow up in maybe 3 or 6 months. If cancer is confirmed, then you start mechanisms to treat. How do we treat the cancer? And you stop it there at that stage. So the earlier you detect the cancer, the earlier you treat it, the better the prognosis, the better the patient outcomes. The later you treat it, the more likely you are going to be exposed to higher levels of invasive therapies, more chemotherapy, more radiation, maybe even the possibility of removal entirely of the uterus, cervix, the vagina, depending on the spread. And for women who haven't had children, you always want to conserve fertility. And if the risk is really high and the cancer is spreading, then you might have to save the person's life, lose the fertility as well. So the importance of the pap smear and checking and knowing your own body, making sure I'm not bleeding at random time points is very important in terms of prevention and also monitoring on your side. That was a part of your question. There were others. There were two more.
That's okay. That's okay. I think I'm answered for now. And talking about prevention, right? If a woman hasn't gone to get a pap smear done, are there any sort of symptoms, let's say apart from bleeding, and it's not like time for my period, that one would typically experience that indicate that, whoa, go and check something else is going on here? Or are we saying you could possibly just be, so you could be at home with no idea until you go for the pap smear?
Yes to both of those questions. And I think I have a slide. There we go. Thank you. That wasn't a planted question, people.
Okay.
I just prepared. So on the left-hand side, these are symptoms. So early warning signs, typically abnormal vaginal bleeding. This would be bleeding between menstrual periods, bleeding after sexual intercourse, bleeding after menopause, so bleeding after you've had your last period of your life, and also heavier or longer menstrual periods than usual, which is why it's important to then know your own body. So is my period, okay, it was 4 days, 4 days, 4 days. Now all of a sudden it's 7 days. What happened? What's going on? And this could also occur as a result of stress. So lots of other things could be going on. You also have unusual vaginal discharge. There could be watery, pink, or foul-smelling discharge, and also pain during sexual intercourse, because this may indicate irritation or other changes within the cervical tissue itself. And this is then early warning symptoms, sitting at home, not necessarily knowing that something was wrong. These would be signs to look out for. Barring following up on those, if the cancer is allowed to progress, then you have the more advanced symptoms. You see the pelvic pain, and this is then persistent or intermittent pain in the lower abdomen or the pelvis, unrelated to menstruation. I don't know if anybody here has ever experienced period pain. We know it can be uncomfortable, it can be debilitating in some cases, and it might also be the pain from the uterus as cancer spreading, pain from the uterus being deferred to your legs or your back. And that's where you get the leg swelling or the leg pain. And this can also be caused by, as the cancerous tissue is growing, it starts pressing on lymph nodes and also the nerves. There could be difficulty urinating or blood in the urine, because if the cancer spreads to the bladder or the surrounding tissues, it starts actually causing, you feel it now, the physical symptoms, and also unexplained weight loss or fatigue. Cancer, it eats away at your body, it eats away at your energy levels, eats away at your actual fat tissue. So if it's unexplained weight loss or fatigue, please feel checked out.
Wow. Okay. I don't know if anyone has some questions. I don't want to hog the mic while people are maybe typing or thinking about it. It might sound a bit silly, but you know what? I'm going to allow myself to be vulnerable and just ask while I have the opportunity. Does the use of a tampon cause certain infections that could progress and cause issues that either lead to cancer or could give some of those other symptoms where you think it's cancer, but it's not? But I know I've read somewhere about tampons and some kind of infections that they themselves cause.
That is a very good question. And though I am not certain yet that there's a link or relationship between tampon use and cancer, I will follow up and get back to you.
Thank you.
It's an interesting one. However, if you are using tampons, your hands need to be clean. The environment that you are in hopefully is clean. We don't always have that luxury. But just keep your hands and your nails as clean as possible if you're using a tampon. Make sure the area is clean. And the applicators are also there to assist in terms of maintaining hygiene in those situations.
Okay, we have some comments in the chat. I'm going to jump straight through. And I think there's also a note from our support team to say, if you have a question you want to speak, please put up your hand and then he'll turn the mic on. Welcome, Moyo. Thank you, said. I understand it as a cancer that affects the cervix. I don't know if you want to add to that or not. Then the other question we had is, Wusisiwe, is it possible for one to reach stage 2B with there being no bleeding? I.e., is that bleeding symptom definite, or it can be absent or hiding, so to speak?
It can be absent, it can be hiding as well. And there could be other clinical definitions of stage 2B. So you would, the safest, not the safest way, the most definite way to check would be the pap smear and also HPV testing as well. And so with cervical cancer, with HPV rather, there's so many different kinds of HPV. Even if you test positive for HPV infection, it doesn't necessarily mean that you're going to get cancer, number one. And secondly, there are variants or strains of HPV that are more likely to cause cancer than others. And because we are aware of the strains of HPV that are more likely to cause cancer, the high-risk strains, we've made vaccines, or we employ the use of vaccines to prevent the progression of the infection now to cancer. So even if you are exposed, your body has the ability to prevent the progression of the virus and hopefully prevent it from developing cancer.
Sorry, can I double check that I've understood? So you're saying that it's possible to go check for HPV and it may be present in one's body. However, it's not a direct indication that it is cancerous. And there are ways to treat that HPV, which then it sort of goes away, right? Is that what I'm understanding?
So there are ways to prevent it from becoming a cancer, ways to prevent it from becoming cancerous tissue. And that is by the use of a vaccine, but that's now prevention rather than cure. Okay.
All right. Thank you. We have another question in the chat. Khotatso, thank you for your note. It says, TikTok content creators have been suggesting that biopsies can lead to the spread of cancer cells. Is there any truth to this?
It's a very good question. Thank you so much, Khotatso, for the question. And I have read, proper time on the side. Sorry if you hear shouting. I have read case studies where just the act of getting a biopsy can cause the cancer to spread. And this is because with a biopsy, you're taking a sample of the tissue and it can cause bleeding. And with bleeding, the body tries to heal itself and like not wash away, get rid of all the dead or dying tissue, and it tries to fix itself. So in that process, you could have movement of cancerous cells that were previously confined in one area or walled off in one area by the immune system, now being exposed to the rest of the body. That being said, I don't know that it happens very often.
Yeah.
And it would happen, in my opinion, with more like with more invasive techniques. So with the pap smear, this is great. But the biopsy is like you're taking a piece out.
Oh, I see. So in other words,
so in
other words, you can get a PAP and still get adequate tissue samples to test without necessarily having to go the biopsy route.
Yes, indeed. Yes. And even if the biopsy would be if the pap smear showed abnormal cells and then more testing showed that there's a problem, and then you go for a biopsy. Biopsy is typically at the staging point. So once cancer has been confirmed. And if you put your finger in your mouth and scratch your cheek, that's essentially that's the same tissue as in your.
What do you mean? Sorry, do you mean like if my nail like scrapes off?
If you okay, no, so I was outside in the garden earlier on. Not gonna put my hand in my mouth.
Okay.
But it's the same, it's the squamous epithelial cells.
Okay.
And it's not dry. It shouldn't be dry. It needs to be a moist environment if everything is going well.
Okay.
Yeah, I think that's it.
Okay, thank you. There are two other comments, but I noticed welcome. Thank you again. It's the same comment as the Q&A. I understand it as a cancer that affects the cervix. And Hotatsu had said also earlier, I believe it's cancer of the cervix, which is at the base or the opening of the uterus. So I'm hoping you're both sort of answered. If not, please shout or shoot your hand up. Okay, so now let's talk a little bit about treatment. Let's say now, unfortunately, cancer's confirmed. We've gone through the stages. We've had the PAP. The PAP has been abnormal. We went for the biopsy, and there's confirmation now that, okay, sorry, it is cancer. Depending on, okay, maybe please just talk to us about that. So if it's found at stage 1, typically, how much time does one have? And does it always mean, like, this is it? I don't know if it's just me, but I hear the word cancer, and it tends to give like a finality to things, right? Yeah. So can you talk about chances of, successful treatment, or does it depend on the stage? Just a little bit about that unfortunate confirmation. What next?
Indeed, indeed. So firstly, there are ways to treat cervical cancer. So it's not like a cancer deep within your brain or some rare kind of blood disorder. We are fortunate that there are treatments, and we've got good survival rates if it's found early. So I think if it's found in the early stages, the survival rate or the prognosis is over 90%. If it starts spreading, like nearby, prognosis is about 60%. But if it's now more metastasized or more across the body, survival rates drop between like 20%, 10%, depending on how severe the spread is and how we manage it, how we treat it. But remember, if the cancer is, especially if it's aggressive, it can move from starting in the cervix and then move up to your lung, move up to your breast, move to different parts of your body, because our body is not just one thing, and we've got these systems in place. Everything is moving through. We've got our blood moving all of the time, lymph is moving all of the time. And yes, cancer cells have the ability to spread. If during normal cell division, some things go wrong now and again, but if our immune systems are fine, we are able to suppress or kill that errant tissue because something is going on, or the errant cells are before they become tissue. In cases where the immune system isn't sufficient, or it's not surveilling well enough, or we have immunodeficiency, which you can see with people who have advanced stages of HIV infection, people with AIDS, people who are on chemotherapy as well, they are immunosuppressed. And in those cases, it might not be enough to protect the body from abnormal growths. That being said, having or detecting cancer early is your best bet. And if it progresses a little bit later on, then that's a different conversation, I think, because then you need to get your family involved, discuss treatment plans, look at where you can find support, and hopefully the support stays with you, because what I've been